an insurance agent in Clinton. My guest in this segment of the morning show is Tony Kirkman, Executive Director of the Piatt County Mental Health Center. Good morning, Tony. How are you, sir?
Morning, Mr. Seth. Doing well. How are you?
Doing good. Thanks for asking. Thanks for making time for us as always. It's good to have you on the program for this morning. And Tony, let's as we get kids back to school, I know you've got school-age kids. I've got school-age kids. Probably many of our listeners have kids that are back to school. And while we appreciate kind of not having that, chaos of the summer where we're, on the go or we've got to worry about kids at home and all those things, Tony, they're in a spot. We know where they're at, that sort of thing. Things calm down a little bit. We also have to talk a little bit about Piatt County Mental Health Center, and I know you're in the schools in Piatt County doing some prevention education and those sorts of things. What does back to school mean for the Mental Health Center?
Oh, wow. Yeah. I join you, Seth. I've got a junior high and a high schooler this year, and they are not as excited as I am for back to school. So here at the Mental Health Center, we got a lot of stuff that we go on. Annually, we normally sit with our local county schools to talk about emergency preparedness. And it's really sad that we live in a world where we have to talk about what is our response during a traumatic event, but that's the reality of it. So we will talk to local administrators and faculty about what is the roles and responsibilities of their local mental health center in the event of a school-wide issue. So it could be active shooter, relocation, death of faculty or student, and just what our emergency response is so that we have a unified approach to treatment. So for example, one of the most recent things we just did was last week, we sat with the schools of Cerro Gordo, Piatt, and DeLand Weldon and talks through a relocation drill and what would be our response to those that have been trauma impacted. And then we'll be doing something very similar with the Monticello School District soon. So we talk about traumatic response. We also talk about this is the opportunity where we start our prevention education work in all of the schools. So I am very proud and honored that we are working with every single school district that's in both the Piatt and the DeWitt County area, and actually increasing some of our services. So we go in and work with junior high and high school students to provide them with evidence-based material of the dangers and the risks of alcohol and substance use as it applies to underage individuals. And so we're looking to increase our footprint at Cerro Gordo Junior High. We're adding a class to Blue Ridge High School, and then super excited about initiating our services at the Clinton Junior High level this year. So gearing up, lots to do, lots of material to review, and just trying to coordinate with administration and faculty about when we can get in to provide the support service.
Now, I know, Tony, in the past, you had a program where you had counselors in all the Piatt County schools. If I remember right, it was like maybe a grant for 3 years or something like that. Is this in line with that program?
No, it's actually a different initiative. So that initiative that you were talking about was a partnership that was formed with the Monticello, DeLand, Weldon, and Piatt school districts as the schools, and the DeWitt Piatt Bi-County Health Department, ourselves, and Kirby Medical Center went in as the providers to try to provide an integrative strategy to meeting emotional and behavioral health issues as well as social determinants of health. And sadly, because of funding issues, that was discontinued at last school year. So, Seth, it's one of those things where it was a needed service. It had great return on investment. And I would love to revisit that if we could figure out a way to financially sustain it. The good news is that there are some work being done at the state level about talking about funding. So Governor Pritzker just recently had one of his bills for behavioral health improvement for Medicaid eligible students approved. And so now school districts will have access to funding, Medicaid funding for those that are eligible for behavioral health services. And then there is also a recent notice of funding opportunity that's coming through the Illinois Department of Public Health to address mental health as a determinant of health. And our local health department administrator has already sent out material to try to make those districts aware of there's funding through a competitive grant if they want to partner. So yeah, lots of good stuff that's potentially out there, but sadly, just you got to find a way to sustain services, and that's kind of the name of the game, sadly.
Yeah, well, again, Tony Kirkman, Executive Director of the Piatt County Mental Health Center, our guest on the phone. And, Tony, anytime you talk about funding, I just always, my mind always goes back to, part of the selling point of the marijuana, legalization of marijuana, adult use marijuana, whatever you want to call it, was, of course, and it feels like kind of the whether it's education, mental health services, human services, they're all kind of pawns in these things. You feel like sometimes, or where they're used as the selling point, and then if we ever go back and hold our elected leaders accountable on these, we'll see the money, I guess, but we never do. And that's got to be a frustrating thing for you, in that, we hear about these records, adult use marijuana, legalized marijuana sales, the lottery, things like that, with the promise of that money going to, agencies like yours. And yet here you are telling us that, well, we can't afford to fund, a counselor in schools at a time when kids have, record, emotional issues and things of that nature. I mean, that's got to be frustrating.
Yeah, it beyond frustrating, because our therapists see things on the front line, and as they emerge, interestingly, as you were talking about, there is a significant amount of tax money that the state of Illinois has put back for, the taxes that they have collected on recreational marijuana. And yes, you're exactly right. We were told that a certain amount of that money was going to go towards treatment providers of those that work with individuals that have substance use disorder, as well as going to minority-owned businesses. And I have not seen the business owner standpoint where that dollars are going, but I attended a meeting in early August, and it was the very first time I heard where some of this cannabis dollars are going. It's going, one of the outreaches of it, it's going through a program called the Illinois Deflection and Pre-Arrest Diversion, which is, again, it's got to be a state acronym or it's not cool, I guess. But the concept is that first responders and law enforcement, when they engage an individual that is associated with substance use disorder, instead of bringing them through the criminal justice system, they're going to give them a referral to a task worker from the Illinois State Police as a recovery navigator. And that recovery navigator is going to engage them within 72 hours and try to encourage them into some type of supportive service, whether that's inpatient treatment facility, if it's outpatient, if it's housing, if it's food pantry. And on paper, that's great. I love seeing individuals go into treatment instead of going into the criminal justice system. But as a group of us providers were talking about this, we were like, you can refer all you want, but if you're still not funding the providers to put more beds or more staff out there, you're just creating a very nice funnel that's going to get locked up when you actually get them to the provider, because we can't afford to hire more staff and we can't afford to have more beds. So it needs to be more of a fully integrated funding than just kind of first point entry of referral.
Mm-hmm. We went a little off the beaten path there, Tony, talking about back to school time and those sorts of things. Do you have any other regular presences or programs in the schools that you work on or work through, anything of that nature?
Yeah, we have a drug-free community grant here in Monticello through the Impact Coalition, and we're really excited. We have been able to pull off a really fun back-to-school event for the last 3 years, and we are working very diligently to get this year 4. We're going to do a virtual scavenger hunt for all Monticello junior high and middle school. So if you think about old school scavenger hunt where you get a piece of paper and you go out and you look at different things, everything is going to be done on their smartphones with parental consent. They can download an app called Scavify, and that's where they tell you where all of your clues are. You take pictures, you can see some of your other teammates in live time of what they're doing. It's a great opportunity for business owners in the community, as well as it's really cool to see about 150 kids descend upon downtown, laughing, having a good time in a safe, controlled environment to celebrate just the gift of fellowship and to remind people about a prevention message. We also obviously provide support services for our faculty. Mental health, mental wellness is a big thing. So looking forward to providing some support services to those districts. And then, of course, just doing the Narcan training that we had, the naloxone training to faculty to help address the substance use issues as it applies to fentanyl and carfentanil exposure.
Sure. Very good. Tony, I look at the clock. Let's take a time out, my good friend. Where do folks go to learn about all things Piatt County Mental Health Center?
Yeah, give me a call, 217-762-5371, or check us out online at piattmhc.org.
Tony Kirkman, Executive Director of the Piatt County Mental Health Center, my guest on the phone this morning. More to come with Tony on the WHOW Morning Show.
WHOW. FB.org.
Let's check the markets now on the RFD Radio Network. I'm Jim Taylor. Corn lower, beans lower, wheat trading steady. September corn 465 down 4 1/4. December corn down 4 1/4. 478 1/4. March corn 492 1/2 down 4 1/4. September beans 1361 1/2 down 8 1/2. November beans down 8 1/2. 1353 1/4. January beans 1363 1/2 down 8. September wheat $6 up 3/4. December wheat up 1 1/4, 626 3/4. September bean meal 412.60 up 280. September bean oil 66.65 down $1.34. Livestock market at this hour. August feeders 245.55 down $1.22. August live cattle down 80 cents, 178.17. October lean hogs 80.25 down 37 cents. Energy market September crude oil 80.77 up a nickel. Jim Taylor, RFD Radio.
At Baum Chevrolet Buick in Clinton or Farmer City, our job is to help you solve your transportation needs. This is Scott Baum, both in Clinton or Farmer City. We'll listen and find options if you need a different used car or truck, or we'll give you repair options to keep your car, truck, or SUV safe and trouble-free so you can continue with your busy schedule. If it has to do with transportation, we're here to help. Visit our full-service team today at Clinton or Farmer City. BaumChevyBuick.com, right from the start.
CEO Paul Scourin here from Warner Hospital and Health Services in Clinton. Call our family medicine clinic now to get your children's school physicals scheduled. We're accepting new patients of all ages. More info by clicking our icon at DeWittDailyNews.com.
For the latest in Central Illinois agricultural news, visit IllinoisFarmRadio.com. Get updated information on markets, weather, ag news, local interviews with NAFB farm broadcaster Jared White, and much, much more. All at IllinoisFarmRadio.com.
Your friend in Central Illinois. WHOW.
Once again, a good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Tony Kirkman, Executive Director of the Piatt County Mental Health Center, our guest on the phone for this morning. Tony, you're talking about kids getting back to school. And, I'm curious if, as I was thinking about this actually this morning. I can't remember why I was thinking about it, but we're at a point where our our kids that went through COVID are kind of cycling onto next stages, right? Like kids that were in junior high are now in high school, and kids that were like, I think about my kids, and they were in the kindergarten, pre-K area of their education cycle, and now they're in second and fourth grade. So they're kind of moving on to developmental stages that are pretty significant. And I'm wondering, like, as kids get back to school, what are you noticing about where kids are at, whether it's emotionally, with their mental health? How about some of those things as we talked this morning?
Well, yeah. I mean, if you think about, every generation has what they call a flash bulb memory. And a flash bulb memory is a significant event in culture that defines a whole generation. I mean, you can go back all the way, well, you can go way back, but, for our parents, Kennedy's assassination would be a flash bulb memory. For us and for me, it was like the Challenger explosion. You now have a generation that's been exposed to 9/11, and now you've got COVID. This is the next flashbulb memory. So, I am so kind of over talking about COVID.
Oh, sorry, I didn't mean to bring it back up then.
Yeah, no, it's good. But I think the beautiful part is that our kids are resilient. It's still there. I think that one of the things that COVID has done was, both for kids and parents, is to create a pause in our life to say, we need more balance, because we can't be redlining our lives to the capacity we were. So that's why there's a lot of focus on wellness and mental health. But I will tell you, Seth, and maybe I'm a pessimist on this, I don't think we learned our lesson. I think we're trying to figure out how we get back. And maybe from a behavioral health standpoint, we shouldn't be looking to get back, but we should be looking to get better. We need more wellness. We need more mental pauses. We need more retreats. We need more sociability. And so I think our kids are coming out of it. I mean, they're far more resilient than we are. But we still have not got to a point where we are out in the community saying, I have a deficiency, I have a need, I am not emotionally well, and that being accepted. Too bad. I mean, we're always trying to put our mask on to say we're perfect and I'm perfect and look at my perfect world, where in reality, the one of the gifts of community is that we're supposed to be able to encourage and resource each other, because at any given time, we're all in need of something. So I don't know if that makes sense. Maybe it's
so I wanted to
way around, but
Well, yeah. I wanted to rephrase it a little bit. Like we are kind of reverting back to where, like, we talk about getting back to normal, right? And that's been a theme of a lot of the news I've covered in the last year or so, is like, oh, we're back to normal. Like this event is happening like it was before COVID, or this group is operating like it was before COVID, like things like that. Like we're doing things that we were before COVID. But like, to your point there, Tony, what you're saying is, we've reverted back to where, like, during COVID, we had such a push for mental health, and it felt like there was so much sympathy for it and so much outreach, and it was top of mind and things like that. We've gone back to before COVID, where it was like, okay, well, do something about it, or like, deal with it, or like, okay, well, there's services, and, like, we don't really, it's just kind of like, it's just kind of a quick, like, we say it, we give our advice as people close to an individual with, battling whatever they're going through, and then we're on to the next thing. Is that a fair assessment of what you're trying to say?
Yeah, no, I think you're 100% right. And I'll probably get myself in trouble for saying this, but, I have a lot of friends that their kids are very, very active in academic, or not in athletics,
extracurriculars.
And others. Yeah. And, I'll see on their posts online of, I had 4 events that I had to go to, and my spouse and I had to divide and conquer, and we've been at 25 events, and we haven't seen each other as a family unit all week.
Right.
It's like, I don't know if that's healthy. Like,
And that's what I was, and that's actually what I was thinking, Tony, when you were saying all that. I was thinking, we slowed down so much during COVID that, we've just picked right back up where we left off with, all the sports and all the activities and all the travel. And we haven't really, I enjoyed just being home and doing, I don't want to say doing nothing, but like not having something on my calendar where I had to be gone 3-4 nights a week. I enjoyed that a great deal. And frankly, I miss it, but such is life, I guess, is kind of how I look at it.
Yeah, no, I agree. I would also say, for the health of the family, one of the biggest things that will keep a family healthy is a healthy marriage. And if you are dividing and conquering and you're not seeing your spouse, and you're not having those regular check-ins, and if your kids are not seeing you spend time together, caring for each other, serving each other, loving each other, Seth, we all grow. And my concern is that as we continue to grow and develop, we're going to grow together, or we're going to be used to dividing and conquering, but we're not going to be together.
Tony, that is a great point. I hate to say this. I got to cut us off. Let's dive into that next month. Like, talk healthy marriages, healthy family units. Let's do that next month. What do you say?
Sounds like a plan for me, Seth.
Tony Kirkman, Executive Director of the Piatt County Mental Health Center, my guest on the phone. Appreciate his time. As always, network news on the way.
The Big 1520 WHOW Clinton, 92.3 FM, W222 BG Clinton, 106.